and welcome to Hudson Valley News and Views. I'm County Legislator Catherine Borgia, and today I'm very pleased to have with me Dr. Grant Mitchell, who is the Westchester County Commissioner of Community Mental Health. Thank you, Dr. Mitchell, for joining us.
Thank you for having me.
Yes. So today we're going to have a discussion about a lot of things, but mainly about how do you recognize the symptoms of mental illness in your family members and your friends? What's your responsibilities? And what do you do when, what resources are available to you when you feel that someone close to you or you yourself need help? So, but why don't we start out talking a little bit about you? You were saying that you left the private sector medical profession to come into the county in 2007, I believe?
Yes.
So why did you make that change? What was your driving motivation?
Sure. Well, I had been in the private sector most of my career.
Yeah.
And what I noticed was that there were some problems with the mental health system and the way we delivered care. And as a private practitioner, I really wasn't able to have an impact in terms of trying to improve the care of the mental health system. And when the opportunity arose in 2007 for me to shift from that private sector to the public sector, I really jumped at the opportunity because I had a sense from being a clinician for many years that the system in some areas was broken and really needed to be fixed, and I thought this would be a great opportunity to try to address some of those deficiencies.
What are some of the things that you focus on, for example?
Well, for example, we would see some of the same individuals coming in for treatment in the emergency room, and we'd see them over and over and over again, and it was clear that the treatment we were providing was not effective, because people would sort of get better, they'd go out, and they would end up back in the emergency room.
So they were only receiving acute care, not systemic care.
That's correct. We were having difficulty engaging people and convincing people really that they needed ongoing care. And so we had this relatively small percentage of the public, maybe 10%, that were using 30 to 40% of the resources by coming back and really not doing well. And I felt like clearly this was a system problem. It wasn't, we couldn't blame the patient. There was something wrong with the system that we weren't engaging people in care.
Yeah. Well, I know we've had a lot of discussions at the county board level after the Newtown shootings came up specifically about what the services are that are available to people, how and what the ties are between mental illness and other types of behavior. But then in getting into the conversation a little bit more deeply, I think the most striking thing that you said to, for example, the Committee on Community Services is that there are so many people who are suffering from forms of mental illness that could benefit from treatment, but who do not seek treatment, either because of ignorance of what's available to them or other types of beliefs. So why don't we start there? Tell me, what are some of the barriers to receiving care when you have mental illness in your immediate circle?
Sure. So I think there are several disturbing sort of facts. One is that 50% of the people that have some kind of mental illness or substance abuse problem never get any care their entire life, and we know that they need it.
Yeah.
Of the 50% that do get care, half of those end up dropping out of treatment. So we're really missing opportunities to dramatically improve the quality of many people's lives, and in fact to save lives, given that some mental illness can lead to suicide. So we're missing a really tremendous opportunity to intervene. And what I think in my discussions over the last 6 years at the county, what I've learned by going out into the community is that people are often unaware of how extensive the resources really are in Westchester that are available. So people assume, for example, that they have to be able to pay for services privately, or they have to have some kind of commercial health insurance in order to get care. In reality, the county has a diverse set of providers and of services that provide a range of services regardless of one's ability to pay for those services. So even someone who has no health insurance and cannot afford care could still be treated at one of our nonprofit-based community mental health centers that has a sliding scale fee schedule where in many cases they're only charging $5 for a visit. So people should not allow sort of the finances to prevent you from getting treatment that you or your family member need.
Right. Let's talk about that. How do you determine when you're at a level where you need some level of assistance?
Yeah, I mean, one of the things that I sort of try to tell family members is that the key word is change. You know your family member, you know your friend, your best friends, your neighbors. We often know what the typical behaviors of our family members and friends are. When you see a change in behavior that seems like the person is doing some things that are really uncharacteristic for them, that's an indicator that something may be amiss. It may not necessarily mean a serious mental illness, but something's going on. And as a friend or a family member, I think it's important to ask and say, I noticed you're not going out anymore. Or I noticed that, you used to be very, fussy about, taking care of your hair or taking care of the way you dressed, and now you're in pajamas all day, and just, something, what's going on? I think it's important to begin to have that discussion and to ask when that behavior changes. And the next step after that is really to talk to your family practitioner or family doctor, because oftentimes these days especially, there is a lot more training that goes on with family physicians, pediatricians, to try to screen people for mental illnesses and either provide some basic treatment if the problem is relatively simple, or to be able to know when a person needs a referral. So if people are not sure whether your family member needs professional intervention or not, a great place to start is with your family physician.
What do you think are some of the barriers to people asking that question? Why would people be reluctant to ask that question of their friends or family members, do you think?
I mean, I think there are a couple of things. I think one is, the most important one has to do with stigma. For many, many years, for decades, there has been a stigma around being mentally ill. And actually, it goes back, to the Dark Ages.
Of course,
so there's always
Greeks and Romans.
Exactly. So there has been a stigma around mental illness for forever. I think it's improving a little bit in the last decade or so, but people are all too willing to talk about if they break their leg or they have some kind of physical illness. They're often unwilling to talk about mental illness because they see it either as weakness. They see it as, they're concerned people will think they're crazy. So people don't want to talk about it. When in fact, it is so common that when I talk to people and I ask, is there anybody, family member, friend, or relative that has mental illness, almost everyone says yes.
It's true.
So it's very common, but you wouldn't think it's common because people don't readily offer that information. Unless you really dig and ask or know them really well. So I think that's unfortunate, because what we've learned in the last 25 years, and particularly in the last decade, about mental illness is that much of it is very much like physical illness in that it is biologically based, there is a genetic component to it, and that we know that it has, in many cases, we've been able to demonstrate through research that these illnesses are based in chemical imbalances. So once we hope that we can convince people that these are medical illnesses, and they're just as important as other sorts of physical illnesses, and that people should not hesitate to get care. But I think we're a long way off from that. And I think you mentioned Newtown, and I think one of the issues with some of the very well publicized violent acts that have occurred over the last 5 years is that sometimes they have involved a person with mental illness. And the problem with that is then the public associates violence with people with mental illness, when 99.9% of people with mental illness are not violent.
Of course, or if they are violent, hurt themselves.
Right. And in fact, the interesting statistic that I saw was that individuals with serious mental illness are 5 times more likely to be victims of violence than they are to be violent towards others.
That's interesting,
So,
I guess that because of some sort of signaling that they're giving that they are in distress.
Correct, and because their judgment is often off, is not correct. So the tendency is to do things with poor judgment. So they may be walking the street at 2 in the morning in an unsafe area because their judgment is not right. So most people are not violent. I think the other thing is that when we look at media portrayals of people with mental illness and mental health treatment, when you look at movies going back, you see that the way people with mental illness are portrayed in movies and the way people who treat individuals with mental illness are portrayed, it's often stereotypes, even starting with One Flew Over the Cuckoo's Nest, where people really, it looked like people were being tortured. And that kind of care, that no one does that. But those films really, in many cases, people remember those scenes. And so I think that, the media has often portrayed people with mental illness and those who provide treatment in ways that have not been positive.
Well, I think that we also do have a history. I mean, when you look at even in the early 1900s, the lunatic asylums and all of the muckraking journalism that was done around how people with mental illnesses were treated, there definitely has been a long, long, long history of being in treatment for mental illness is not a desirable place to be. So
Absolutely.
You can see people's reluctance for that. It's interesting that you say, there are often these biological causes, and I think that if people thought about mental illness as even an ongoing persistent mental illness, persistent depression, bipolar disorder, that if people thought about it in the way that they think about, for example, diabetes, that it's a disease that has to be managed. You always have to be vigilant. It's an extra thing that you have to do that somebody else might not have to do, but it is something that you can manage within the course of various types of treatment. And I know there's a lot of discussion. You and I were talking earlier about medication. Medication has, of course, come a long, long, long way, and people probably do live much better lives as a result of new medication. But that's not the only way that people can go about being treated.
Absolutely, and I think your points are well taken. I think that we have a host of treatments that are effective now, and what's interesting is that there are many people that are around us every day, people we work with, people that are neighbors that have mental illness and are in treatment, and we don't even know about it because the treatments can be effective, as you said, at managing those symptoms. And I know people who are, in all walks of life, professionals, homemakers, accountants, who have mental illness but have learned how to manage that illness in collaboration with a mental health professional, sometimes with medicine and sometimes without medication. So there are a host of treatments. We have better evidence about what works and what doesn't work. We have medications that have fewer side effects than meds that we had even 10 years ago, because people are, have visions of being sedated and feeling like they're on, they're drugged up. And many people are functioning, driving, working, and quite successful in treatment. And people need to understand that many of the conditions are manageable, and you can live with them and lead a happy, productive life.
Right. Happy, fulfilling life.
That is true.
Yeah. Well, I think that statistic about 50% of people with mental illness not receiving treatment is just staggering, not only because just the loss of human potential, that people should be leading better lives and could be, and that there are successful ways to treat this particular diagnosis it's just heartbreaking, really, because it's a loss for all society that people are not functioning at their top capacity because they're suffering from something that can be treated. It would be like saying, we're not going to clean people's cuts.
Exactly, and just let it turn into a worse chronic infection. No, that's absolutely true, and I've seen people like that who have been ill and symptomatic for years before coming into treatment. And what I often hear from them when they are treated is, I should have done this a long time ago. And so we want to sort of cut down that time from when people become symptomatic to when they get treatment by understanding that modern treatment is different than what it used to be. It's different than it's portrayed in the media. And we talked a little bit about, there are definitely situations where people have ideas that if I get into treatment, I'm going to be put on medication. I think it's important to note that many people are in treatment are not on medication. It is something that I take very seriously before putting somebody on medication. And many people are successfully treated with other forms of therapy, cognitive behavioral therapy, for example. And so people should not assume that if they go to treatment, they're going to be put on medication. Second thing is, as a patient, you have the right to say, I don't want medicine. I want to try other forms of treatment rather than medication. So I think that's important. And I think the other thing is that in some cases we're finding that medications are being overprescribed. And there are more and more articles written about how people in some cases are over-medicated, are medicated unnecessarily. For example, I had an individual visit me who was a first-year law student who did not have any mental illness, was not taking any medication, went to law school, makes an appointment to see me after the first semester and says, I want to be put on a stimulant medication, a Ritalin, some kind of stimulant for ADHD. And I said, but why? I mean, what symptoms do you have? And he explained to me, which I was found, indicative of a problem in our society, is that he said the majority of the students in his law school were taking medicine for ADD, stimulants, for performance enhancement. They were not ill. They did not have ADD, they did not have ADHD, but they felt that the medicine gave them a boost and a competitive edge in their studies. That is clearly an inappropriate use of medication. It's an inappropriate use of treatment and should not be done. And unfortunately, that is being done in some cases. And so we have to be really careful about making sure that before we prescribe medication that we've got a proper diagnosis and that we're in fact treating a real condition and not starting to use these medications in ways that are inappropriate.
Well, I think that's part of our culture. There's drug advertising on TV. I know, when I was a young mother and my children would have ear infections, people would always say to me, did you get antibiotics? Did you get antibiotics? And I'm a sort of use antibiotics last kind of a parent, so I would always say, well, we're going to try, these other things first. But people really, I think, we've been trained either by the media or by pharmaceutical companies, I don't know, to really always look for, people feel like they need to walk out with a prescription.
Absolutely.
Otherwise, it's not a successful doctor visit.
That's right, because they want to, it's seen as a quick fix. It's seen as a lot easier and simpler, for example. Doing therapy, cognitive behavioral and other kinds of therapy, talk therapies, takes time.
Right, and it takes a commitment.
It's a commitment and it's time. So
an
I absolutely agree.
Really.
Oh yeah, that too, absolutely. In fact, one of the things that I tell people, I used to tell people in a first visit with me, is that we're going to get into talking about some things that may be uncomfortable, and I want you to know that sometimes you may leave my office, feeling worse than when you came in, and they sort of look at me like, well, why would I come here if that were the case? And I said, but it's in the longer term interest. It's part of the process, which means we're going to have to talk about some things that may be unpleasant for you, things that happened in your past, traumas, et cetera. So, and they understand. They come to understand that. But so yeah, that's an emotional commitment. It's a time commitment, and so there are people who want the quick fix. But then again, I do have others who are so afraid of medication and who actually need it and could benefit from it and are afraid. And so one of the things that I often talk to people about is another misunderstanding or myth about mental illness and medication is that if I go on medication, I'm on it for the rest of my life. That is not true. Many people are able in time to come off medicine. Sometimes the reason why you're having an episode of depression or anxiety or some kind of psychiatric or mental health condition has to do with what's going on in your life at that time.
Right, so it's situational?
Correct. And in some cases, that situation, in time, you learn to either adjust to it or it passes and you no longer need medicine. So many people are able to come off medicine. So one should not assume that if I go on meds, I'm on it for life.
Right. Well, I mean, that does make sense, especially if you're in a depressive episode and so that you are able to come back to a functioning level that enables you to, for example, make the emotional and time commitment to do something like cognitive behavioral therapy. That could be like a boost to get you to the place where you need to do other types of therapy. So I think that sounds right to me. That sounds logical. Let's talk a little bit more about the stigma attached to mental illness. We touched upon that a little bit, but I think it's interesting. Certainly in my experience, when I talk to people about this topic, and I was, when you came to the Community Services Committee, it was on my mind for a couple of weeks, so I actually wound up talking to a lot of people about this. It was very rare. I don't think I spoke to one person who didn't have someone in their family or one of their close friends, and actually I was tallying up the suicides that were 1 or 2 degrees separation from me, and it was like 4.
Exactly.
So it was. It's very eye-opening, I think, and part of the reason why we really need to work to educate people to break down these stigmas is because people shouldn't feel that they're alone in this suffering. People shouldn't feel that. This is a personality weakness or a shameful secret that I have to not talk about in my family, that there is this, this tendency. And I know that anxiety and depressive issues do run in families. So what's some of the ways that we can start to do that?
Yeah, I mean, I think you're absolutely right. And those are some of the the stereotypes that lead people to avoid talking about it and to avoid getting treatment. And when people don't talk about it, when you don't feel well, you tend to think it's only me or it's only my family because it's not talked about. So that kind of feeds the whole cycle of not getting treatment and feeds the stigma. One of the things, there's a movement now to get people to kind of come out and talk about either themselves or a family member that has, some sort of mental illness, to sort of get away from the mystery and the feeling that it's only me. I had a great opportunity about a year and a half ago at a mental health benefit function. I was seated next to the actress Glenn Close. And Glenn Close has a sister, this is public, she has a sister who has serious mental illness, bipolar disorder. And for years, she found that her sister was, embarrassed. The family tried to hide it. And, they were talking one day, and she said, she was telling me how she told her sister, this situation with mental illness is never going to change unless we are willing to put it out there. Unless we're willing to say, I have this, I'm not ashamed of it. And more people will then see that and say, well, if it's okay for her, it's okay for me. So she actually started an organization called Bring Change to Mind. Which is an organization that works to reduce stigma, and they put up billboards, and they run public service commercials. And so, for example, one of their billboards reads, "How would you feel if you were blamed for having cancer?" Because people with mental illness sometimes are blamed. It's a weakness. There's something wrong with you. You're weak. So there are organizations starting to crop up that are focused on stigma, and we believe in Westchester County that this is an effort we want to join. We have begun to talk to that organization and to look at what we can do within Westchester County to try to reduce stigma and get people into treatment, because we know that it's so important. And the earlier you get care, the better off you are in terms of the course of your illness.
Right. Well, that's an interesting thing, and it actually kind of ties back to your example of the law student, which is, I think part of what happens, especially in competitive communities like we see in Westchester County, that another reason people don't maybe are not willing to come out and talk about this, because they do feel that that they'll be seen as somehow inferior. And I know, especially in school districts, and I have seen this even within my own school district and among my circle of friends, that people don't want to acknowledge any weakness that their children have, because they feel that it will disadvantage them in the race for good grades and being in the gifted program and getting into the best college.
Absolutely.
And all of those things. Although I will say that parents do often fight to get learning disability.
Yes, they want extra help.
They want the extra time
at that age,
and the extra help.
That's absolutely right. But that is absolutely right. And they feel like it'll disadvantage them. There's also a sense still of sometimes embarrassment and shame. I think the other thing, which I really blame partly us in the profession for this, is that years ago there was a culture of blame, which was that somehow if your child, even if they were growing up teenager, had a mental health problem, somehow it was due to faulty parenting. It was
the mother's fault.
And that, primarily the mother, who was blamed for it. And we now know that that's just nonsense. I mean, so I can understand, though, in that kind of culture and that kind of thinking, people wouldn't want to come out and admit this because it says something negative about we did something wrong in raising our child.
Well, and I think also when you see your child suffering, I mean, that's a very heartbreaking situation, and people are very, nobody wants for their children to suffer, and people don't want to have the child's peers or teachers or people that the child interacts with treat them differently, look at them as somehow damaged.
Absolutely. And that is a big issue because of course we're saying this is not something to be ashamed about. The problem is not everybody thinks that way. So if you're brave enough to do that, or the information gets out, there is risk that other kids and other adults will still have the old attitudes towards it, and so it is a risky sort of thing to do. So I understand why people are hesitant to do it.
Well, that's why the advocacy organizations, I think, are so powerful.
They are,
because that information. Kids don't learn attitudes out of thin air.
No,
right?
that is absolutely right.
It comes from the culture in which they're exposed.
Absolutely. And I think one of the things related to that I was just thinking about is that one of the things that's really important about both suicide and those violent episodes that some of which make the media and some of which don't, is that in nearly all cases, the individual who either attempts suicide or commits a violent act tells somebody that they're having thoughts like that.
Yeah.
Not every case, but in many cases, in most cases. And I think one of the things that's really important is that people are often put in the position when someone says that to you.
What do you do?
What do you do?
Right.
And how do you know if this is somebody just saying, oh, I feel like killing myself, which unfortunately people sometimes say and they don't mean.
Right.
Or is this a serious thing that I need to do something about? And one of the things that we really try to do in terms of educating teenagers, especially adolescents, is if somebody tells you a secret, and that secret includes thoughts of suicide, you cannot keep that a secret.
Right.
Because you don't know whether that person is serious. That you should tell someone, whether it's your parent or someone in the school system guidance or a teacher, because you wouldn't want to assume that that person didn't mean it and have something bad happen. So that's one of those secrets we try to teach people you should not keep.
Well, I think that teens have divided loyalty too, because the relationship with their peers is so powerful at that age in particular, and then as they grow into adulthood, they can put those peer relationships more in perspective. But I could see teenagers feeling that they would be betraying the trust of a friend by going to someone. But I think it is very important that if your friend is in trouble, you always have to help them, and how you help them is by telling this secret.
Absolutely, and I think that the way you just described it is really the way kids have to look at it, which is not that I'm betraying their loyalty, but rather I may be saving their life.
Right.
I may be doing something that's helpful, and even though they may be, and this does happen sometimes, mad at me for a bit, hopefully that person comes to understand that I did this because I was worried about you.
Right, and it came
and
out of affection.
Right, correct, that I care.
Yeah.
That it was not done to tell on you. And obviously the response to that shouldn't be that the kid gets in trouble.
Right.
It should be that someone intervenes to determine whether in fact this person needs some help.
Yeah. I want you to talk a little bit about the push-in programs that you have in schools and why you thought that was a good solution based on some budgetary cuts that school districts are having. But I wonder if you have an opinion about, a lot of our schools have zero tolerance policies for misbehavior. Obviously, for violent behavior, there's a different standard. But even for some behavior that might be, especially in younger children, actually signs and symptoms of depression or anxiety or other mental illness, that maybe our educators need to be given a little bit more understanding about how mental illness could manifest, especially in younger children.
Yeah, absolutely.
Yeah.
I mean, I think mental illness in younger children does not look like it does in adults sometimes. So adults have a better ability to kind of describe how they're feeling. So we can ask an adult whether they're feeling down, whether they're having appetite problems, whether they're not sleeping well. Younger kids especially aren't always in touch with the right words.
Right.
So what you have to look for in younger children in particular is behavior change. It's back to the change again, but behavior change. So a kid who suddenly says, I don't want to go to school, something going on there.
Right.
Could be that they're being bullied, but it could also be that they're having some kind of psychological issue. Kids will complain of headaches and stomach aches and physical symptoms.
Right.
And the first temptation is to either say, well, you have a stomach ache, you'll be okay,
Right.
or if it keeps happening, to bring them to their pediatrician. That's okay.
Right.
Because hopefully that pediatrician will say there's nothing wrong, and if it keeps up, we'll make a recommendation or referral.
Right.
So it's things like physical symptoms, it's even aggressivity. You'll see kids that have not been aggressive suddenly becoming aggressive. And it's like, this is not my child, what is going on? Or a kid who doesn't come out of their room, spending a long, long time. Now, if that's normal for your kid, then you don't have to be so worried about it.
Well, it's interesting because what is normal? Because kids do go through different phases.
Absolutely. Absolutely. And we don't want to, put a pathology label on every behavior. Kids go through stages of development in which they can be, labile and their behavior can be unpredictable. We don't want to necessarily label everything as a mental illness. So you're absolutely right. I think if you have questions, you ask your pediatrician.
Right.
But I think what you really want to look for is this my child? And is this the way he or she, usually behaves? And if not, what's going on? And I think you also want to look at functioning. If a kid is, let's say, a B student, and all of a sudden now is failing, something's happened.
Right.
Those are the kinds of changes we tell parents. You have to look into that because something's going on. Maybe drugs, it may be a mental illness, it may be something else, a learning disability, but you have to really know your child and notice those sorts of things. And it's amazing how many times we see kids who are using drugs inside a house and the parents don't know. Sometimes the neighbors know, other people know, other kids know, people are talking about it. The parents don't know.
Because of denial, because of...
Well, we don't, it's a mix of reasons.
Yeah.
Sometimes denial, sometimes they don't actually know what to do.
Yeah.
Sometimes they hope it'll just stop. So it's important to pay attention to those signs and to act on them, not to ignore them.
Now, is substance abuse, do you think, especially in teens, an indicator of mental illness as a general rule?
Sometimes it is.
Yeah.
We do find that kids and adults will self-medicate using alcohol commonly, but also other drugs as a way to help them sort of escape from what might be depression or anxiety, to kind of self-medicate.
Right.
So that is a very common thing.
I just read an article, actually it was a review of Mad Men, the TV show Mad Men, that said that this writer was positing that the reason why the post-war generation drank so much, and people my age cannot drink the way the people in their 80s can drink. No way. Was that it was post-traumatic stress from the Second World War.
Yeah, there are people, you're absolutely right. There are people who are using alcohol for all kinds of reasons. Traumas, escape, even being I've seen people who are drinking, they're in a job they hate and they feel trapped.
Right.
And they drink to, at lunchtime to escape.
That doesn't lead to productive afternoons.
No, it doesn't. It doesn't, absolutely not. But it's amazing how many, we talk about a functional alcoholic, people who are still going to work and earning a living and drinking a substantial amount. Yeah. You also raised the issue that we didn't address, which is the issue of the mental health treatment in schools.
Right.
One of the things that we know is over the last 10 years, slowly but significantly, services in schools, particularly around social workers, school psychologists, those services have substantially been reduced in many districts due to budget cuts. And of course, what we found was that those individuals were providing very important services. The fact that they're no longer there, or they're there in many fewer numbers, we have felt that on the mental health side, namely a growing demand for community-based mental health services because of the absence of those individuals in schools. And so one of the things that we decided we might want to do, and we ended up doing and has been, I think, very successful, is we began several years ago in collaboration with nonprofit agencies, putting mental health clinics inside school district, inside schools, buildings. The advantages were amazing. One was that we were able to really integrate those services into the rest of the school.
Right.
Two is that it addressed some of the stigma issues, which is you're not going to a mental health professional or a clinic in a community. You're actually getting treatment that is part of the school's health system, the nurses, et cetera. So there was less stigma. The treatment could be delivered during the school day.
And I would assume that the professionals and the students developed a long-term relationship of trust that had to be helpful in the treatment as well.
Absolutely, that's very important. So we have grown the number of clinics and mental health treatment options inside schools in Westchester has grown substantially over the last few years, and it's been very, very successful thanks to the collaboration between the county and our nonprofit partners. And we think it's a great model. Others are talking to us about doing that because, in particular, we find that there are certain school systems and school buildings that have asked us for that service, either because they've had a more significant cutback in the funding for school personnel, and so we really target those mental health services to districts that tell us they really have a great need. Some do not. but some really do, and they really appreciate having us there.
Sure. I mean, it's no different really than the community health center in the school model that does things like strep tests and, eye exams and ear infections and things like that inside the school building that leads to, so parents don't have to take off from work and reduces absenteeism among students. And it's the same sort of model. It's a holistic approach to providing these types of services.
Absolutely. And we're actually very pleased. I mean, you mentioned holistic. One of the things that we've known about for many, many years is, that this is connected to this.
Right.
However, we've had two completely separate systems, right? So you go to your medical doctor for your physical health problems, and you go to a separate system and a separate, treating clinicians for emotional issues. We know that they're very much related. If you have a serious medical issue, you're more likely and at risk to have an emotional reaction to that. And if you have psychiatric illness, you are often more likely not to take care of yourself physically.
Right.
So what we know now, and what is finally coming to fruition, is that thinking, which we've known for a long time, is finally making its way into the treatment arena. So what we're seeing in Westchester County and spreading really, it's a movement that's spreading throughout the country, is we're seeing mental health services being added to physical health services for kind of a one-stop treatment center. And we're finding that is happening with increasing frequency. We're also finding that nurse practitioners and some doctors are now visiting mental health centers to provide physicals and basic medical care for diabetes and high blood pressure and things like that, so that people can get care in one place, the place that they're comfortable in, and not have to go to another place, which again is a way to address stigma.
Right, in addition to being an efficient delivery model. So that's
absolutely.
I think that's wonderful, and I think that there still needs to be probably education components for all the people in the health field about that interconnectivity. I guess the president is looking for the final frontier to be the space.
Yes, that's absolutely right. And I think you raised an issue before about sort of the no tolerance policy in schools. One of the things that we were finding is that as early as in preschool and actually daycare, kids would get kicked out of daycare because of bad behavior. I mean, it was hard to fathom that a 3-year-old or a 4 couldn't be managed in a daycare center because of bad behavior. And so a number of providers got together in collaboration with Board of Legislators funding and county execs several years ago, and created the Early Step Forward program. The idea there was, number one, the earlier we intervene with behavioral problems, the greater the likelihood is that we fix those issues before they become more significant as you get older. The second thing was that if you simply take a child who has bad behavior and you just eject them from the program and have a no tolerance so they can't be in school, you're not really helping the problem. I understand why it's done, but ultimately that kid is now home. So how do you, what this program, what I think is interesting about Early Step Forward is that if you look at their data, as a result of intervention at the daycare level, is that in a year's time, out of over 1,000 kids that were in daycare, none, after the intervention was put in place, none were actually needed to leave the program. So it's effective, it's cost effective, and like early intervention on the physical health side, excuse me, it ultimately improves quality of life and saves money down the road.
Sure. I mean, prevention is always better, but I do think, again, it goes to that whole quality of life. If a child gets labeled a bad kid at 3 years old, that child has very little chance of succeeding in the subsequent 80 years.
That's right. And we're sort of saying, let's try to get to the roots of why that child's behaving that way, and let's try to provide corrective help. And the way it's done is not by assigning them to work with a mental health professional. It's done by training daycare workers how to recognize the behavior and how to manage that behavior as a daycare worker. So we kind of avoid the stigma because these are not, your child is not in mental health treatment and is not being treated. It's more helping the daycare employees to manage and help that child learn how to behave more appropriately so that they can succeed later on.
Right, so we need that that level of training somehow to trickle up then to parents and to school district professionals and even, out in the society, so that people have this understanding and also know how to direct people to the correct level of help that is available to them.
That's absolutely right.
Yeah.
I mean, that's absolutely right. Because, as I said before, there can be too much treatment,
Right.
and then unfortunately most people get little to no treatment,
Right.
or they don't stick with the treatment. So you're absolutely right.
Is that because of the nature of mental illness? People don't stick with it because...
I mean, the illness itself sometimes gets in the way, which is, first of all, nobody wants to have any illness.
Right.
So there's denial.
Right.
Nobody wants to sort of be on medication.
Okay.
It's just not, for at least most people, it's
Right.
not a pleasant thing
Right.
on a long-term basis. And I think the third thing is because of the stigma, specifically around mental illness, there's a feeling of, I don't really, I'm not crazy. And we have to get away from that thinking, because
Right.
most people with mental illness, it's not about being crazy. It's about this medical illness.
Right.
I think the other reason that is important is that people will often, all the myths that we discussed earlier kind of get in the way. And I think the final thing which is important is that what we find is when a person has a strep throat, they take antibiotic. Most people do not finish the course of antibiotics.
Yeah, that really makes me mad.
Well, the reason they don't finish the course, as you know, is
They
the
feel
throat
better.
feels better, right? And then you end up, contributing to resistant bacteria.
So that when people have like staph infections...
That's right. But here's the interesting thing. In mental health, it's the same issue,
Yeah.
which is that people with a depression or an anxiety condition or any kind of mental health issue, oftentimes when they feel better, they stop their medicine.
Right.
Now, they're not producing a resistant bacteria from doing that. But what happens is then you have another episode.
Right.
And after a while, unfortunately, you can get into a cycle of illness followed by recovery, followed by illness, followed by
That goes
recovery.
back to what you were talking about in the private sector.
That's right. And then
Yeah.
what happens is you suddenly now you lose your job.
Right.
Because you haven't been able to attend work on a regular basis because you've been sick repeatedly.
Right.
And so part of the
Yeah.
education is that you can't stop your medicine just because you're feeling better.
Right.
In time, you may be able to wean off with doctor's advice. But many, many people stop medicine as soon as they feel better.
Yeah. When my sister was an intern at Downstate Medical School, one of her jobs was to go to people who had TB, and they have to take the course of medicine for a year.
Yep.
So that's 9 months after you feel better. And
That's right.
She would have to go to their home to make sure that they were taking their medicine, because we don't want a more virulent form of TB to erupt in a general population.
Absolutely.
But I think that maybe it's human nature too, that we have to sort of fight against that tendency.
Absolutely.
To,
I think the other thing that people should know is that we have in Westchester County, we have a 24-hour crisis hotline, which I think is important for people to know, because one of the things that happens is that people often don't know where to start.
Right.
Where do I start? And this crisis service, which is physically based at the St. Vincent's campus of St. Joseph's Hospital in Harrison, answers the phone. They answer the phone 24 hours a day, 7 days a week, holidays, etc. If you have either a mental health crisis at home with a family member, or if you simply don't know where to turn
Right.
in terms of getting help for yourself. They can help you with referrals. They have access and they know all of the resources. So people should also know that service exists, and I know we're going to provide that number.
Yeah. And that's a 24/7.
Absolutely. And they have a number of capabilities. For example, let's say you have a family member who's depressed or has an anxiety condition, they can't or won't leave the house. Well, how are you going to get somebody treatment if they won't leave the house?
Right.
This program, if you need them, will actually come to your home, and they will do an evaluation or an assessment at your home if you have an individual family member who simply cannot, because of their illness, or won't go out and to an appointment at someone's office. So they have a whole range of capability. They also have office where you can be seen at the Harrison campus, or they have a campus in Yonkers at St. Joseph's Hospital, so you can bring your family member there for an evaluation, or they can help you by phone. So there really are options with that single number if people don't know what to do.
Right.
that they can call.
So
and
this, oh, go, I'm sorry,
yeah.
go ahead, sir. Go ahead.
Same thing is true for an individual who may be feeling suicidal. They can call this hotline, and the hotline can help steer them toward getting care.
Yeah. Speaking of suicide, what would you say? What are the signs that someone might be suicidal? You mentioned that people often do tell someone.
Right. I mean, one thing is that they tell someone. The second has to do with a variation on the theme that I've been mentioning throughout the show, and that has to do with this issue of change. So, for example, we find that people will start giving things away, saying goodbye, in a way where family members sometimes say, this behavior is strange. They don't really understand what it is. So giving things away, saying goodbye, are examples. Sometimes noting that a family member, when you know they're undergoing a major stress, for example, people who've been laid off from a job, people who have just undergone a separation or divorce, those are major life stresses and can contribute or precipitate a depression or some of these changes in behavior or even suicidal thoughts. So I think it's important for people to pay attention to that change, pay attention to those behaviors like giving things away, and taking every statement of suicide seriously, regardless of whether you think the person is not, doesn't mean it or not. It's important to bring that to someone's attention.
Do you think people, when people are do make a statement or do exhibit some of this behavior, that they are looking for assistance? Is that a cry for help?
Sometimes it is.
Yeah.
We find that sometimes people are talking about suicide because they want intervention, and the problem is sometimes they don't get it.
Right.
And so that's the risk of
And
sort
that
of crying out.
their belief.
That's right. I mean, several individuals who have survived really serious suicide attempts have said things like, I was crying out for help and really nobody paid attention, and that had somebody said something, I might not have done this. So it really is important to pay attention to that when things like that are going on, because suicide is one of those very much preventable, potentially preventable causes of death in the United States.
Right. Well, I think there's so much. As I mentioned, I have knowledge of 4 families that have had suicides and have been friends or family members of friends, and there's so much survivor guilt, after a suicide. And of course, the person who commits suicide is not thinking clearly. You talked a little bit about how people, when they are making serious suicide attempts, believe that the world would be better off without them, or that their family would be better off without them. They're not really realizing the impact that their death will have on people. But obviously it's a terrible, terrible human loss to have to lose someone to suicide. But also, I think it has such a ripple effect impact on people's families and people's family history and what they believe about themselves and the culpability that they feel.
Absolutely. No, you're absolutely right. I think there is a tendency to feel, why didn't I see it? Why didn't I do something?
Yeah.
How could we have missed it?
Yeah.
And we spend a lot of time talking with survivors and families about that person who commits suicide, that it was their decision and their responsibility in a sense, and we try to talk about those guilt issues, and we find that one of the things that's helpful is that there are support groups for families that have undergone or experienced a suicide of a family member or relative, and they can often gain comfort from that, because when families get together and say, you know what, it happened to us too, and we didn't see it and we didn't know either, there's a sense that this wasn't a failure on the part of the family. So I think that is absolutely true.
Yeah.
That is true.
Yeah, well, I think also it is mental illness. Even though we have made so many advances, it's still mysterious. We don't necessarily understand completely exactly what's going on and that's why there's a lot of trial and error with respect to the types of treatments that work, right? So
that is true. That is true, in fact, because we're not at the stage yet where we have a blood test or an X-ray or some kind of test, and I think that's part of the mystique and part of the stigma around it. You can't prove, in a sense, with a test that someone has mental illness. And I think that it absolutely contributes to the stigma. It contributes to people's resistance to getting care. We are getting close to that, though.
Yeah,
I will tell you, there are new tests that actually, blood tests that are not yet commercially available, but they're on the way in the sort of next 5 years or so, that will help us determine when somebody is experiencing a depression, for example. And there are PET scans, which is a sort of enhanced kind of MRI, CAT scan, very fancy sort of scan, and they're very expensive, so they're not being widely used, but that are beginning to show changes in the brain that we can see on a scan that indicate
Like brain circuitry or brain activity?
brain activity.
Interesting.
That can help us diagnose, and those things are on the way. That's really the new frontier, the next frontier in mental health treatment, is that we're going to have better diagnostic tools, and we're going to have tools that will help us determine which medicine, if medicine is indicated, which medicine might be the best type of medicine for you. Whereas now we don't really know. It's a bit of trial and error. So those things are on the way.
Yeah.
And that part is very exciting.
That is exciting. This reminds me of when Lyme disease first erupted and how there was so much mystery around that, and people's symptoms were so unexplainable, and people would have it for years before they were diagnosed as old Lyme. But now it seems that there's a lot better ability to diagnose different types or early Lyme disease and get people the treatment that they need so that they don't have these long-term devastating effects as a result. So same sort of thing.
And I think that'll be a huge step for us, because it will make what now feels to some people as kind of a subjective thing. There's, you know, how do you know that I really have this? You know, the way we know now is because the symptoms and the way they present and the way they're described, you can look it up on the web, you can look it up in a book. It's actually amazingly consistent. When I see people with a clinical depression, the symptoms are often consistent from one person to the next, even though people's lives are different.
What other symptoms?
Inability to sleep, decrease in appetite, lack of interest in activities that you previously loved. All of a sudden you say to that person, so would you like to see a movie? And they're a big movie, and they say, I don't really feel like it. Not going to work, inability to concentrate and focus, feeling low energy and fatigue. Now, none of these by themselves would be a diagnosis, because people feel fatigue, but as a constellation, a grouping of symptoms, that those are indicators. And I see it over and over again. It's to the point, actually, where there are many times where I can see someone, when I was working in hospital settings or in emergency rooms or even in a waiting room, and I can see that they're clinically depressed before they even describe the symptoms.
Interesting.
Because people have a downcast, depressed look. Now, I'm not saying that everyone does. There are people who actually have an uncanny ability to smile on the outside when they're really feeling great pain inside. So we can't, that's not a proper way to make a diagnosis. But what I'm saying is that the symptoms are very consistent in spite of it feeling to people like the diagnosis is very subjective and sort of feels like, well, this isn't really an exact science. It's remarkably similar.
Yeah, that's very interesting. I think that's interesting too, that it physically manifests
Absolutely.
so dramatically.
Absolutely, and you just raised something we didn't mention, I just would mention quickly, is that the proof, in a sense, that depression, for example, is a physical illness, it has psychological symptoms, but it's physical, is that people with depression often get real physical symptoms. Not physical symptoms that are in their head, they're real physical symptoms. For example, they will have all kinds of aches and pains that are real. They will get constipation, for example. Now that's a real symptom. So we know this is a physical illness. We know this is a chemical imbalance.
Point, you know, that obviously all of the systems are connected. We learned that in 8th grade biology.
Absolutely.
Yeah.
So these are real, these are physical illnesses, and they have real physical symptoms. And those are not symptoms that are in someone's head, they're real.
Yeah. So, as you know, as we're concluding the conversation, tell me, what do you think? What's the thing that you would most like to see? What can people do that would most improve people's ability to reduce stigma, people's ability to get treatment that they need, people's ability to recognize when their loved ones are in distress? What are some of the things that regular people can do in order to sort of help tackle this problem?
Yeah, I think one of the things is, I talked about sort of coming out and admitting that you know somebody. I don't know that people have to do it in the same public way that Glenn Close did with her sister, where they
Or
came
Jane
out.
Pauley, that was very
Absolutely.
dramatic.
But you are seeing more. Brooke
Yeah.
Shields, and a whole list
Right.
of public figures that have come out and admitted it. But you can do that on a very small scale. So when you know that someone, and you see someone is suffering, or you hear about it, it is helpful to be able to say, I know somebody, or we have someone in our family that has that. And to be able to do that and admit that is so helpful, because it reduces the stigma and it normalizes the process, and it makes you not feel alone or ashamed. So I think people can do that in very small ways by admitting when they know someone, and someone you trust and care about, by admitting, you know what, we've been through that. That can go a really long way, much more so than a billboard, for example, because it's a personal outreach. So I think that's really, really important.
Yeah, so we need just a little bit more kindness towards each other.
Absolutely, absolutely. And understanding, that these are real medical issues, and that we have to really try to address the false beliefs around this and challenge those.
Right. And just again, review for us, what do you do if you're concerned, or let's say you're concerned about someone with whom you don't necessarily have that level of intimacy that you could have a conversation like that. Say it's a coworker or a student, a fellow student in a school.
Right.
What are some of the things that you can do just as a bystander?
Yeah, I think that's a good question. I think there are a couple of options. One is you can let somebody know who does know them and has a close relationship.
Right.
I'm concerned. I'm noticing your friend or your family member is doing this. I'm just saying it because I care, not because, and you can decide that what you're going to do with that. But so that's one option. The other is you can go up to somebody who you don't know particularly well, but a coworker, and there are ways to say it, like, I'm worried about you. You used to come in and you were always happy, and now you just look sad. I'm just worried about you. Are you okay?
Are you okay? Yeah.
It's not a criticism.
Yeah.
It's an "Are you okay?" and a pat on the back. That alone can open a dialogue and can pave the way for somebody to get help.
And someone, just that outreach to know that someone is concerned about
That's right,
them.
and they noticed.
Yeah.
So I think there are simple things like that. The other things that we mentioned already, just in summarizing, I think are talk to your pediatrician, talk to a family member, a pediatrician, or a family doctor, or call the hotline if you really don't know what to do.
Right.
And they can help direct you to resources that can be helpful in those situations.
Right. Well, thank you very much. This was an interesting conversation. We could go on for another hour easily. I'm very pleased about all of the innovative work that the county is able to do under your direction. So congratulations to you on that. And I think we're going to start seeing some real fruits of your labor as because of your very, I'll use again, holistic approach to these issues. And I'm hoping that this is one in a continuing series of opportunities that you have to get this word out to people in Westchester County. Thank you very much.
Well, thank you very much for having me.
Yeah,
it was important.
It was, and certainly very interesting and very educational, I think, for me, and I hope for the audience as well. So, it's really been my pleasure. So that concludes this episode of Hudson Valley News and Views. Please join us again next time.